Welcome to another deep dive. Today, we're going to go beneath the surface of something you probably haven't given much thought to,
Hmm.
abdominal hernias.
Okay.
We've got excerpts from medical textbooks, patient summaries, the whole 9 yards to guide us.
Great.
Now I know what you're thinking.
What's that?
Hernias, seriously. Doesn't sound very exciting.
All right.
But trust me, this is way more interesting than you might expect.
Oh, okay.
We're talking about a weakness in your abdominal wall, and believe it or not,
Yeah.
it's a surprisingly common issue.
What's fascinating is that hernias affect millions of people every year,
Wow.
and they're not just a minor inconvenience.
Right.
Some hernias can even contain entire organs.
Okay, that's a visual I was not quite prepared for.
Oh.
So let's start by getting a handle on the basics.
Okay.
What exactly is a hernia, and what are some of the different types we might encounter?
Well, imagine your abdominal wall as a tightly woven fabric. A hernia happens when there's a weak spot in that fabric, allowing the contents inside, like your intestines, to bulge out.
Gotcha.
And these weak spots can pop up in a variety of locations, leading to different types of hernias.
I'm starting to understand the hidden aspect of this topic.
Mm-hmm.
These hernias can be lurking beneath the surface, right?
Exactly. Take incisional hernias, for example.
Okay.
These develop at the site of previous surgical incisions. In fact, they're so common that they account for a whopping 20% of all hernia surgeries.
Wow, 20%. That's a lot higher than I would have guessed.
It is.
So it's not just about the surgery itself,
Right.
but the potential for a hernia to develop later on.
Precisely.
Okay.
Think of it this way.
Yeah.
Every surgical incision creates a scar. And sometimes that scar tissue doesn't have the same strength and integrity as the original tissue.
Okay.
This creates a vulnerable spot where a hernia can form.
That makes a lot of sense.
Yeah.
So what makes some people more prone to developing these incisional hernias? Is it just bad luck, or are there certain risk factors at play?
Well, there's definitely an element of individual variation in how our bodies heal.
Sure.
But several factors can increase your risk.
Yeah.
Things like wound infection, obesity, smoking, even certain medications can interfere with the healing process and make a hernia more likely.
So it's not just about the initial surgery.
Right.
It's about how well you heal afterward,
Right.
and whether any underlying conditions might be working against you. And you mentioned earlier that some hernias can become quite large.
Yes.
What happens then?
Those are often referred to as giant ventral hernias, and they can be quite challenging to treat.
Oh, I bet.
Imagine a bulge the size of a grapefruit or even larger protruding from your abdomen.
Okay, now I'm getting a little squeamish.
Oh, yeah.
I can only imagine the discomfort
Right.
and potential complications that could arise from something that large.
Yeah.
So how do doctors go about repairing these hernias, whether they're small or those giant ones you described?
There are two main approaches:
Okay.
sutured repair
Yeah.
and mesh repair.
Okay.
Sutured repair is basically what it sounds like, using sutures to stitch the weakened area back together. But this approach has its limitations, especially for larger hernias.
I can imagine trying to stitch together a giant hernia would be like trying to patch a hole in a sail with a needle and thread.
Right.
Not very effective.
That's a great analogy.
Thanks.
And that's where mesh repair comes in.
Oh.
It involves using a surgical mesh, kind
Yeah.
of like a reinforcing patch, to strengthen the weakened area and reduce tension on the repair.
So it's like giving that weakened spot some extra scaffolding to hold everything in place.
Exactly.
Okay.
And there are different types of mesh, both synthetic and biologic, each with its own pros and cons.
Interesting.
Synthetic meshes are strong and durable,
Okay.
but can sometimes lead to adhesions, where the mesh sticks to the surrounding tissues.
And I'm guessing those adhesions aren't a good thing.
No, not really.
So what about the biologic meshes? What are those made of?
Biologic meshes are derived from human or animal tissue that's been specially processed.
Okay.
The benefit is that they tend to integrate better with the body's own tissues and have a lower risk of causing adhesions.
So it's like choosing between a sturdy synthetic patch or a more natural biocompatible option.
Right.
But how do surgeons decide which type of mesh is best for a particular patient?
It's a multifaceted decision.
Yeah.
Factors like the size and location of the hernia, the patient's age and overall health, and even their lifestyle can influence the choice of mesh material.
It sounds like there's a lot to consider.
Absolutely.
But what about the placement of the mesh? You mentioned earlier that it's not just about the material, but also how it's used.
You're absolutely right.
Okay.
The mesh can be placed on top of the repaired muscle layer,
Mm.
within the defect itself or even tucked beneath the muscles.
Oh, wow.
And the chosen placement technique can significantly impact the long-term success of the repair.
This is getting pretty technical. So tell me, which placement method is considered the gold standard and why?
The sublay technique,
Right.
where the mesh is placed beneath the muscles, is often favored because it provides the strongest reinforcement and tends to have the lowest recurrence rates.
So it's like creating a solid foundation for the repair, tucking that mesh underneath everything to provide maximum support.
Exactly.
Okay.
It's all about understanding the anatomy and biomechanics of the abdominal wall and choosing the best strategy to restore its integrity.
So we've got a good handle on incisional hernias now.
Okay.
But what about all those other types lurking out there? I'm ready to explore the world of hernias beyond the surgical scar.
Well, let's shift gears then and delve into another common type that often appears in a very different location,
Where's that?
the belly button.
You're talking about umbilical hernias, right?
Exactly.
Okay.
They're quite common in infants,
Yeah.
often presenting as a cute little outy belly button.
I remember thinking my niece's umbilical hernia was just an adorable quirk. But tell me, what causes these belly button hernias, and is it the same story for adults?
In babies, it's often a developmental issue where the opening for the umbilical cord doesn't close completely.
Oh, okay.
But in adults,
Yeah,
acquired umbilical hernias are usually linked to increased pressure on the abdominal wall.
I see.
Things like pregnancy, obesity, or even chronic coughing can put stress on that area and cause a hernia to develop.
So it's all about that pressure pushing against a potentially weak spot in the belly button area.
Exactly.
And I'm assuming the repair techniques are similar to what we discussed with incisional hernias?
You got it. Sutures or mesh, depending on the size and severity.
Okay.
But now let's talk about a type of hernia that's a bit more under the radar.
Okay.
The Richter's hernia.
Ooh, a hernia with a mysterious name. What makes this one so special?
Well, imagine a door closing on your finger, trapping just a portion of it.
Oh.
That's kind of what happens with a Richter's hernia.
Oh.
Instead of a whole loop of bowel getting caught in the hernia opening,
Yeah.
only a part of the bowel wall gets stuck.
Ouch. That sounds painful and potentially dangerous.
It can be.
So why is this type of hernia so tricky to diagnose?
Because the symptoms can be subtle and mimic other conditions.
Okay.
It might not cause a complete bowel obstruction,
Yeah.
so doctors might not immediately suspect a hernia.
Yikes. So it's like a silent threat that could escalate quickly.
That's right.
What happens if a Richter's hernia isn't caught in time?
That trapped portion of the bowel can become strangled,
Oh, wow.
cutting off its blood supply.
Oh, no.
This can lead to some serious complications,
Yeah.
including tissue death or gangrene.
Definitely not something you want to mess around with.
Nope.
It sounds like early detection is absolutely crucial with these Richter's hernias.
It is.
Okay, so we've covered incisional umbilical.
Right.
And now this sneaky Richter's hernia.
Yeah.
Are there even more types of hernias out there?
Oh, there are more. All right.
All right, give it to me.
We've got epigastric,
Mm.
spigillian, and lumbar hernias,
Wow.
each with their own unique characteristics.
Well, I'm definitely intrigued. Let's unravel these other types, starting with the epigastric hernia.
Mhm.
What makes this one stand out?
Epigastric hernias pop up in the midline between your belly button and your breastbone.
Hmm.
They're often small and might just feel like a little lump or cause some mild discomfort.
So not as dramatic as the giant ventral hernias we talked about earlier?
Not usually,
Okay.
but they can still be a nuisance.
Right.
And repair is often recommended to prevent potential complications.
Got it. What about spigillian hernias? What makes them special?
These are the ninjas of the hernia world.
Hmm.
They develop along a line on the side of your abdomen,
Okay.
often hidden beneath the muscles.
Oh, wow.
That makes them tricky to spot during a physical exam.
So how on earth do doctors find them?
Imaging techniques like ultrasound or CT scans are usually needed to confirm the diagnosis.
I see.
And because they're harder to diagnose,
Yeah.
there's a higher risk of them becoming incarcerated, which means the contents can't be pushed back in.
Okay, those spigillian hernias definitely sound like something you want to catch early.
For sure.
And last but not least, we've got lumbar hernias. What's the story with those?
These are the rebels hanging out in the lower back region.
Okay.
They can be caused by things like surgery,
Hmm.
trauma, or even just a natural weakness in the area.
Okay.
And just like with the others, they can range in size from small and asymptomatic to large and problematic.
So a whole spectrum of hernia shenanigans happening in all different parts of the body.
It really is.
It's making me wonder if I have one and just don't know it.
Oh.
But before I spiral into hypochondria, let's talk about a condition that's often confused with a hernia. Diastasis recti.
Ah, yes. This one's important to clarify because it's not a true hernia.
Okay.
Instead, it's a separation of the abdominal muscles, often seen after pregnancy or in people with central obesity.
So that explains why I've heard so many new moms talking about it. It's basically that stretched out tummy look that can linger after having a baby.
Right.
But if it's not a hernia, why are we even talking about it?
Because it can cause similar symptoms to a hernia,
Okay.
like a bulge in the abdomen or back pain.
I see.
And while it might not pose the same risks as a hernia,
Yeah.
it can still impact core strength and functionality.
I can see how that would be frustrating, especially for women trying to get back in shape after pregnancy. Is there anything that can be done to fix it?
Exercise can help strengthen the abdominal muscles,
Okay.
and in severe cases, surgical repair might be an option.
Gotcha.
It's all about regaining that core stability and addressing any functional limitations.
Welcome back. Before the break, we were talking about all sorts of hernias. Incisional, umbilical, even that elusive Richter's hernia.
Right.
And I have to admit, it's making me look at my own abdomen with a whole new level of scrutiny.
Well, it's always good to be aware of potential health issues, but hopefully we're not causing too much anxiety.
Just a healthy dose of curiosity.
Good.
Speaking of curiosity, you mentioned that hernia repair techniques have evolved significantly over time.
Yeah.
I'm really interested in hearing more about that.
It's a fascinating journey, really.
Okay.
For centuries, the primary method of hernia repair involved suturing the weakened tissue back together. It's a straightforward concept,
Yeah.
but it had its limitations.
I can imagine trying to stitch those tissues together, especially for larger hernias, must have been quite a challenge.
Yeah, it was.
What were some of the drawbacks of this traditional approach?
Well, imagine trying to sew together a piece of fabric that's already stretched and weakened.
Okay.
Those sutures would be under a lot of tension,
Yeah.
and the risk of the repair breaking down or the hernia recurring was significant.
So it was a bit of a gamble hoping those stitches would hold up against the constant pressure within the abdomen.
Exactly, and that's where the introduction of surgical mesh revolutionized hernia repair.
Okay.
It's like adding a reinforcing patch to that weakened fabric,
Right.
providing extra support
Hmm.
and distributing the tension more evenly.
That makes a lot of sense.
Yeah.
It's like giving those tissues a much-needed backup system. But didn't we talk about different types of mesh earlier?
We did.
How has that technology evolved?
Absolutely. Early meshes were often made from synthetic materials like polypropylene.
Okay.
They were strong and durable,
Yeah.
but could sometimes cause problems down the road.
What kind of problems?
Well, sometimes the body would react to the synthetic mesh as a foreign object,
Okay.
leading to inflammation, scar tissue formation,
Yeah.
and even those adhesions we discussed earlier.
So it was a bit of a trade-off, stronger repair, but potential complications from the mesh itself.
Right.
I remember you mentioned biologic meshes as well.
Yeah.
How do those compare?
Biologic meshes are derived from human or animal tissue, so they're more compatible with the body's own systems.
Okay.
They tend to integrate better and have a lower risk of causing those inflammatory reactions and adhesions.
Yeah. So it's like choosing between a sturdy synthetic patch
Yeah.
or a more natural bio-friendly option.
Right.
But I'm guessing both types of mesh have their place in hernia repair, depending on the situation.
You're exactly right.
Okay.
The choice of mesh material depends on several factors,
Yeah.
including the type and size of the hernia, the patient's overall health,
Okay.
and the surgeon's preference.
It sounds like a lot of thought goes into selecting the right mesh for each patient.
It does.
But what about the surgical techniques themselves? Have those changed as well?
Absolutely.
Okay.
Along with advances in mesh technology,
Uh-huh.
we've seen significant progress in surgical techniques,
Okay.
particularly with the advent of laparoscopic surgery.
Laparoscopic surgery, that's the minimally invasive approach, right?
That's right.
Tell me more about how that works and why it's become so popular for hernia repair.
Imagine this.
Okay.
Instead of making a large incision to access the hernia, the surgeon makes a few tiny incisions and inserts a laparoscope, a thin tube with a camera on the end, into the abdomen.
So it's like getting a tiny peek inside the body without having to open everything up.
Exactly.
Okay.
And the surgeon uses specialized instruments inserted through those tiny incisions to repair the hernia using mesh.
Wow, that sounds incredibly precise. What are the advantages of this laparoscopic approach over the traditional open surgery?
Well, for starters,
Yeah.
smaller incisions mean less pain,
Hmm.
faster recovery time,
Okay.
and reduced scarring.
Gotcha.
Patients can often go home the same day or the next day after surgery and return to their normal activities much sooner.
That's a huge benefit.
It is.
I can see why laparoscopic hernia repair has become so popular.
Yes.
It's like trading a major construction project for a quick and efficient renovation.
That's a great way to put it.
Thanks.
And because the surgeon has a magnified view of the surgical field through the laparoscopes,
Yeah.
the repair can be even more precise and effective.
So it's a win-win situation for both patients and surgeons.
Absolutely.
It's amazing how technology and innovation are continually improving the way we approach medical treatment.
It's a testament to the ingenuity and dedication of medical professionals who are always striving for better outcomes for their patients.
Okay, we've talked about the different types of hernias,
Mm-hmm.
the role of surgical mesh,
Right.
and even the advancements in surgical techniques. It's
Yeah.
a lot to take in.
It is.
But what I'm still curious about is, what are the warning signs? How do you know if you actually have a hernia?
That's a great question.
Yeah.
And it's important to remember that hernias can present in a variety of ways.
Okay.
Sometimes the most obvious sign is a noticeable bulge or swelling in the abdomen, groin,
Yeah.
or back.
So if you see a bump that wasn't there before,
Uh-huh.
that's a pretty good indicator that something might be up.
It's definitely worth getting checked out.
Okay.
But hernias don't always present with a visible bulge. Sometimes the only symptom might be a dull ache or a feeling of pressure or discomfort in the affected area.
So it's not always a dramatic presentation.
No.
It could be something more subtle that people might even dismiss as just a muscle strain or indigestion.
Exactly. That's why it's so important to pay attention to your body and any unusual sensations you might be experiencing.
Okay.
And if you have any concerns, don't hesitate to talk to your doctor.
So it's all about awareness,
Ah,
listening to your body,
right.
and seeking medical advice if anything seems out of the ordinary.
Yeah.
But what if a hernia goes undiagnosed or untreated?
Hmm.
What are the potential consequences?
Well, in some cases, a hernia might not cause any significant problems
Okay.
and might even shrink or disappear on its own.
So there's a chance it could just resolve itself.
It's possible,
That's good to know.
but it's not something to rely on.
Okay.
The bigger concern is that a hernia can become incarcerated or strangulated,
Hmm.
which could lead to serious complications.
We touched on those terms earlier, but I think it's worth revisiting them,
Uh-huh.
especially since they sound pretty alarming.
They are.
Can you break down what those terms mean and why they're so concerning?
Sure. When a hernia becomes incarcerated,
Yeah.
it means the contents of a hernia sac, like a limb of intestine,
Right.
gets stuck in the hernia opening and can't be pushed back in.
So it's like getting caught in a doorway.
Yeah,
You can't go forward or back.
that's a great analogy.
Thanks.
And when a hernia becomes strangulated,
Yeah.
it's even more serious.
Okay.
It means the blood supply to the trapped tissue is cut off, which can lead to tissue death and gangrene.
Okay, now I understand why those terms are so worrisome. It's like a ticking time bomb that could have devastating consequences if it's not addressed promptly.
Exactly. That's why early detection and treatment are so crucial when it comes to hernias.
Right.
It's always better to err on the side of caution and seek medical attention if you have any concerns.
So if you notice a bulge, feel any unusual discomfort, or have any concerns about a potential hernia,
Yeah,
don't hesitate to reach out to your doctor.
that's right.
It's better to be safe than sorry. But what about prevention? Is there anything people can do to lower their risk of developing a hernia in the first place?
That's a great question, and it's one we'll delve into more deeply after the break.
Okay.
We'll explore some lifestyle modifications and strategies that can help strengthen your abdominal wall and reduce your chances of encountering this hidden health issue.
Stay tuned as we uncover the secrets to hernia prevention. Welcome back to our deep dive into the world of abdominal hernias. Before the break, we were talking about the importance of early detection and treatment, and I'm really curious to hear more about what we can do to prevent these sneaky things from happening in the first place.
Well, while we can't completely eliminate the risk of developing a hernia, there are definitely some things we can do to strengthen our abdominal walls and reduce our chances.
Okay, I'm all ears. Give me the inside scoop on hernia prevention.
One of the most important things is maintaining a healthy weight.
Okay.
Excess weight puts extra strain on the abdominal muscles, making them more susceptible to weakness and herniation.
So it's all about taking care of your core. both literally and figuratively.
Exactly. And speaking of core strength,
Yeah.
regular exercise, especially exercises that target your abdominal muscles, can help build a more resilient abdominal wall.
I can see how a strong core would be like a built-in support system, helping to keep everything in place.
Right.
Are there specific types of exercises that are particularly beneficial?
Exercises like planks, crunches, and Pilates moves are all great for strengthening your core muscles.
Hmm.
But it's important to start slowly and gradually increase the intensity and duration of your workouts.
So no need to jump into an intense workout routine right away.
Right.
Gradual progress is key.
Absolutely. And proper lifting techniques are crucial,
Yeah.
especially if you lift heavy objects regularly.
Mm.
Always lift with your legs, not your back, and
Yeah.
avoid straining.
That's good advice for anyone, hernia or no hernia. But what about things like smoking and chronic coughing?
Yeah.
We talked about those as risk factors earlier. Is there
Yeah.
anything that can be done about those?
Quitting smoking is one of the best things you can do for your overall health,
Okay.
and it will definitely reduce your risk of developing a hernia.
Gotcha.
And if you have a chronic cough, talk to your doctor about finding ways to manage it effectively.
So it's all about taking a holistic approach to health.
Yeah.
Addressing those underlying conditions that might be contributing to your risk.
Exactly.
But what I'm still wondering is, what does the future hold for hernia treatment and prevention?
Hmm.
Will we see any groundbreaking advancements in the years to come?
It's an exciting time to be in the field of hernia research.
Really?
Scientists are exploring new materials for surgical mesh that are even more biocompatible and integrate seamlessly with the body's tissues.
So even better versions of the meshes we currently have. What else is on the horizon?
We're also seeing advancements in minimally invasive surgical techniques, making the procedures even less invasive and the recovery even faster.
Wow.
And who knows, maybe one day we'll have gene therapies that can strengthen our abdominal walls and prevent hernias from forming in the first place.
Wow, gene therapy for hernias. That sounds like something straight out of a science fiction movie. It's amazing to think about the possibilities.
It's truly remarkable how far we've come in our understanding and treatment of hernias.
Yeah.
And with ongoing research and innovation, the future looks bright for those facing this common health issue.
Well, it's been an incredibly informative journey exploring the hidden world of abdominal hernias. We've covered everything from the different types and their causes to the latest advancements in surgical repair and even the potential for future breakthroughs.
Hopefully, our listeners have gained valuable insights and a greater awareness of this often overlooked health concern.
And remember, knowledge is power. If you suspect you might have a hernia, or if you have any concerns about your abdominal health, don't hesitate to reach out to your healthcare provider.
Early detection and treatment are key to preventing complications and ensuring a smooth recovery.
Thank you for joining us on this deep dive into the fascinating world of abdominal hernias. Until next time, stay curious, stay informed, and take good care of your amazing bodies.